Hi, and thank you all for listening. My name is Anton Saleh. I turned 16 this month. I'm a sophomore at Beverly Hills High School, where I'm active in student government and sports. My friends say I'm an outgoing guy and a natural leader. The guy who knows lots of people and who can make connections and things happen. For me, these things come easy. I've always liked people and loved to socialize. It's fair to say I'm a Facebook addict, although my current obsession is getting my driver's license. Before I was diagnosed with cancer, my daily life was filled with pretty typical teen stuff, primarily related to school. I've always looked ahead and hoped to go to a good college, so I took quite a few honors courses. I also was a class officer, athlete, and community volunteer. So that's my brief history in a nutshell. But it's not what I'm here to talk to you about. I'm here to share a much more difficult tale. My life with cancer. My father helped me write these remarks, but I wanted to make sure you heard my story. Most people asked how I found out about it. Truth is, at first, I didn't really think anything was wrong. I had a nasty rash that wouldn't go away. The rash didn't itch, and my clothes simply covered most of the outbreaks. When the rash caused my eyebrows to fall out, I simply let my long hair cover that. On September 23rd, 2009, as the red rash and the hair loss continued to spread, despite ointments and topical creams, I found myself sitting in the oncologist's office. After spending about 30 minutes in a waiting room surrounded by adults, each one sicker than the next, I got my diagnosis. "You have cancer," the doctor said. I don't remember much else. My day-to-day life didn't change immediately. After all, I wasn't like the other patients in the clinic. I was young with an old person's cancer. Aside from all the tests, I still felt okay. School at 7 a.m., check. Government activities, check. Football, first team, check. Parties and hang out with friends, check. But when my detailed test results came back, things changed. Turns out I was at stage 2B, just teetering on the knife's edge of the great fall to stage 3 of my cancer. Unfortunately, there was no conservative option. I would have to take a powerful drug called targetin and need to get intensive UV light treatment 3 times per week. Targetin comes in a giant capsule. It gave me headaches and exhausted me, so I took it before bed. The UV treatment was not bad at the beginning. I'd missed some classes for appointments, but I managed and felt no need to change my life. Over the weeks, the medication dosage was increased and the UV intensity as well. My skin shed, peeled, itched, and burned. Bathing hurt, lotions were excruciating, and my clothes felt like sandpaper. You can only imagine what it felt like to put on the football gear in practice. Despite what I was going through, I did not want it to change my life. But no matter how much I fought it, the cancer and its treatments took their toll. My grades started to decline, the A became a B, and the B became a C. As terrible as this process has been, I count myself fortunate that my cancer treatment is ongoing. Despite significant hardship, my family has been able to pay for my cancer treatment, but not all families can. A decade ago, my father shopped for medical insurance for our family. As the son of a top cardiologist, he understood well the potential costs of serious illnesses and wanted to purchase the best possible policy, providing coverage for catastrophic events. Then my cancer came, and the diagnosis revealed the deficiencies in our coverage. And as it turns out, copays only applied to so-called formulary medicines on Health Net's approved list. The prescription I needed to treat my disease was obviously not on the list. Let me try to put this in perspective for you. The drugs I take to treat my cancer are $40 per capsule, and I presently take 4 per night. At present, my medication is nearly $5,000 per month and $60,000 per year. Despite knowing that this medication is necessary to save my life, HealthNet has repeatedly declined further support. We even tried to get the manufacturer of the drug to place me on a program that would have reduced the cost of my prescription, but they politely declined, citing my age as the reason. My parents, of course, did whatever they could to find the funds for my treatments. In fact, my father sold our family home, which he had lived in for 50 years, to make certain we had the money for my medicine. I know there's a lot of criticism of our healthcare reform law, but I'm here to tell you it has already made a huge difference for my family and me. In April 2011, thanks to a change brought upon by the Obama administration, we were able to change insurers during a brief window of opportunity. We now have insurance that covers much more of my prescription costs. Even with all we've gone through, we consider ourselves lucky. My family does have a nice home in Beverly Hills we could sell to pay for my medication. However, I wonder, how do other families manage? Must they accept poverty after exhausting their resources, turn to charity, state and federal programs? The reality is, we are all one diagnosis away from poverty. We are all seduced by the exaggerated promises of catastrophic medical coverage. We are all modern indentured servants for the healthcare insurance coverage that coverage may be inadequate and misrepresented. How can we be informed choice as to what constitutes adequate coverage if that coverage is changeable? How do we negotiate with an insurance company when we have no market power and little information? We have also been fortunate that both of my parents are well educated and resourceful enough to find solutions to continue my treatment. Also, I'm thankful that both of my parents are fluent in English. I can only imagine how difficult it must be for people who have limited English proficiency. How would a person with limited English proficiency be able to navigate the complex medical and insurance system? When people do not understand their doctors, and their doctors do not understand them, good medical care simply cannot happen. There are 23 million Americans who have limited English proficiency. Poor communications between providers and patients can lead to medical errors and is costly both to patients and the U.S. healthcare system. I guess what I want to say to those of you listening to this is thank you. The work each of you do day in and day out is a lifesaver for people like me. Because you push for the Affordable Care Act, my family is able to change our insurance without worry of my pre-existing diagnosis. I will be able to remain on my parents' health care insurance up to age 26. Insurance companies will now be held accountable, and an additional 32 million Americans will get insurance coverage. And for cancer patients like me, coverage is now required for routine patient care costs with those with cancer who are enrolled in clinical trials. Existing insurance plans are barred from imposing lifetime caps on coverage, and out-of-pocket costs will be limited for those that purchase coverage through the new health insurance exchanges. I personally dream of an America when people no longer have to hide their medical history to prevent prejudicial actions. What's the matter with everyone knowing I have cancer? We need to keep on supporting the groups like the Health Forum. We need to continue to push for health justice. Keep on doing what you all are doing and advocate. Thank you.